Hello everyone, and welcome to the first of my new style CEO videos. As I promised to each of you in our one-to-ones, these are going to be short, but each month I'm going to be encouraging two people from around the company to come on the videos with me and talk about areas that they are responsible for. Now, the aim of me doing this is to grow the knowledge base across this very wide and diverse organisation, grow that knowledge base of what we're doing around the company, but equally I'm going to really encourage you to watch these videos, and if you're interested in what's being said, please contact these people and collaborate. I'm really hoping that as a result of these videos we'll be able to replicate the great work that's going on in certain parts of the area all the way across the business. So today we've got two videos and I'm very grateful to our speakers. First of all, we've got Sheetal from our India office talking about a very successful and unique program they've got in India called our Continuous Engagement Program. And then secondly, Julie Halfacre, Laura Lacey are two renowned industry experts in the area of rights and licensing and permissions, and they're going to talk about that part of business. But first of all, over to Sheetal to talk about the Continuous Engagement Program.
Thank you for giving me this opportunity for speaking about CEP in India. The concept of Continuous Engagement Program is to offer a comprehensive educational program for target doctors with the strategic objective of meeting their learning needs. The course content is curated from BMG resources and it can be partly commissioned if there's a need. So this plan was originally created for the sponsorship market in India, which includes the pharma and the device companies. Since the pharma industry in India is still print dominated, we have the flexibility to offer the CEP in print or in online format. However, we feel the concept can also be offered to specialized institutes in future. So how does this work? We follow a four-step process here. The first step is to understand the client's therapy area to be focused and target specialty, which is done by the sales and the marketing. The second step is to understand the learning needs of the doctors in the desired therapy area. The BMJ editors and the external disease experts are involved at this step. The third step is to curate the relevant content, which is largely our existing content, and offer it at a fixed frequency. Our BMJ editors help us doing this. And the fourth step is the delivery of the content in the preferred format, which is done by the technical and the operations team. Now, with the government's focus on Digital India, we are hoping to see a gradual shift from print to online requirements, from pharma also in future. So we have built our LMS system which helps to offer the curated content from different BMJ resources at a single platform. In fact, some of the LMS features also include the capability to host webinars, which can support up to 2,000 users. It has a chat support system. Multiple speakers can deliver lectures from different locations. There's quiz support for user interaction. There is image and video galleries. There are customized course pages, auto emailing, territory-based usage reports, and more. In fact, currently we are working on optimizing the features of the LMS. So basically, our aim is to have a defined ROI for the client in terms of a quality of content and great user experience, which will in turn help in increased usage and renewals. In the end, I would like to conclude by saying that by creating the LMS platform locally, we have had a very quick turnaround time and lesser cost and good quality. Thank you.
Thank you, Sheetal. It's a really successful program in India, so please get in touch with Sheetal if you think you can collaborate and replicate that locally. Now, as you know, I have been meeting with all of you, and as I record this video, I've met 430 of you for one-to-one meetings, and I've really enjoyed that, and they've been very rewarding. And I'd like to share with you some of the most common themes that have come through. The first one of those is the overriding theme, which is everyone's pride in working at BMJ and everything that we stand for at BMJ. That's an unbelievably gratifying experience to sit down and hear time and time again how proud the people are to work with BMJ. But I've been asking people to talk about things that they'd like us to focus on or perhaps prioritise and change. And there are 7 things that have come through that are the themes that have repeatedly come through in the conversations. The number 1 has been the need to improve our commercial viability. And so we need to sell more of our existing products, but we need to diversify our product base whilst also ensuring that we optimise our costs and processes. So commercial is certainly an area. The second theme that's come through is, can we have single sign-on? And the answer is, I will do my best to try and ensure that we do. The third theme that's come through is a general feeling that we need to be efficient right the way across the business. So efficiency and performance management has been very common as I speak to people. Theme 4, fewer systems. Lots of you have talked to me about the volume of systems that we have, and some of our systems don't talk to each other. So certainly I shall take that on board and see what we can do to reduce the number of systems that we've got. Another theme has been, don't forget the hubs. Now our 3 hubs in Hoboken, Delhi and Beijing have seen incredible success, and the plea from the people in those hubs, as well as people here in London and in Cardiff of course, has been to make sure that we don't deprioritise them, and remember when you're doing your work to think about involving the hubs. Theme number 6, focusing on the core business. It seems to me that you really want us to focus on the things that we do well and not get distracted into areas that perhaps fall outside our core competencies. And then the last theme is data. And let's make sure that we use the data to make our decisions. Data-driven organisation is really important, so let's look at the data when we make our decisions. So those are the 7 most common themes, and over time, in the future videos, I'm going to share some of perhaps the more quirky things that people have said to me, as well as give you some progress on how we're doing in delivering on those themes. So now on to our second guest video, our spotlight, and it's a spotlight on rights, licensing and permissions. Julie Halfacre and Laura Lacey are going to talk to us today about the work that they do.
We are the rights and licensing team. We're a very small team, just 2 of us. I'm Julie.
And I'm Laura, and we sit in the journals department at BMJ.
Our business is based around the reuse of BMJ material. As a team, we don't create anything, but we rely on the teams within the company to create really good quality, important content that we can then license out to external parties.
A lot of our content is from leading publications, and we sell permissions to reuse content from these. Everything from short extracts, figures and tables to reuse in books, journals and presentations, to abstracts and whole articles which we license to people like our local edition publishers to create new products. Everything we do in our department is designed to maximise profit whilst at the same time keeping within copyright rules, protecting the BMJ brand and making sure that everything is presented in a way we're comfortable with.
Through various licensing agreements, we earned 2.4 million in 2016. This is a growth of 85% since 2012. And the main reason that this area has grown so much is we've really concentrated on renewing existing agreements and making sure they really work for us, and signing up to new agreements that will benefit BMJ.
In 2017, we look forward to working with other products around BMJ and maximising the profit that we can make from licensing for them.
So if anyone wants to get in touch with us, we're in the rights and licensing area in journals, and we're happy to have any discussions around licensing of journals or any other products.
Thank you, Julie. Thank you, Laura. Please do get in touch with Julie and Laura if you feel that the rights and licensing business is something that you can replicate or you'd like them to work on your area of the business. So finally, this month, I'd just like to share with you again my vision for the company and the areas that I am going to be focusing on and the general direction of our business. And I've shared all of this with you in each of our one-to-ones. But just to say again, the things that are important to me, our vision of a healthier world, our values, and we're going to do some work on the values so that we can all get a tighter list of the values. And I really hope that everybody is going to be able to say our vision is a healthier world and our values are 1, 2, 3, 4, 5. So vision and values, lots of work this year, whilst also ensuring that BMJ continues to be a great place to work. Vision, values, great place to work. But alongside that, we're definitely going to have to look after the commercial health of the organisation by selling more of our existing portfolio, diversifying and launching more products, acquiring products while we can, whilst also optimising our costs and processes across the business. And I look to everybody for what's my new catchphrase, consistent efficiency. I encourage you to be consistently efficient right the way across the company. So finally, and I've said this to every single one of you, you have a direct line to me. Please use it if you have anything you'd like to say to me, questions or comments or thoughts or ideas about the company. Please do get in touch. And I look forward to seeing you for my next CEO video next month. Thank you, everybody.